Hello, everybody, and thank you so much for joining us today. We are here with Senior Deputy Commissioner Veronica Judo-Cecil and Jennifer Dudinsky with the Provider Enrollment Team. So we're very grateful for their time today and appreciate you all taking the time to join us to get updates on information related to the Public Health Emergency Unwinding and how it may impact providers specifically, and things that you can do at this time and act on. So we're going to have a presentation from Jennifer and Veronica today, and then we'll have some question and answer sessions towards the end of the presentation. So I welcome you to continue to use the chat throughout today's session to submit any questions you may have. But we also received a couple questions from your registration, so we'll start there. And anything that we don't cover, we will update the FAQ online to make sure that we are answering for you all. So everybody is muted today, except for our presenters. So appreciate that ability to just listen in and hear what theirs has to say. But feel free to chat in if you're having any issues. So with that, I can turn it over to you, Veronica.
Hi, thank you, Helen. And I also welcome everyone to the virtual forum today. We've been hosting stakeholder forums, and if you were able to join last month, we held 3 of them. The point of having this special one for providers is we wanted to really focus on the changes due to the ending of the public health emergency that may impact you and your business, and also to make you ensure you're aware of what is going on with the Medicaid members that you see in your practice every day, so that maybe ways that you can help us support those members as they're going through a renewal. We are going to turn off our videos when I start the slideshow, but we'll come back on and see you when we're answering questions. Thank you. Hey. So our agenda today is to talk to you about the need for you to complete and submit a revalidation if you've not done that, and Jennifer will talk a little bit more about that. We do want you all to understand the upcoming changes that are going on with the end of the public health emergency. We're going to give you all a few ways, and we're requesting that you help and support patients that are going through that renewal, and other ways for you all to stay informed as we go through our unwinding period. There we go. Okay, so just to reiterate, the White House notified us in January that they were going to put an end to the public health emergency effective May 11th. Also in December, the Consolidated Appropriations Act did delink or disconnect the continuous enrollment coverage that we've been utilizing since the start of the pandemic in March 2020 to keep individuals, Medicaid members, covered throughout the public health emergency, not acting on changes in circumstances that might have affected their eligibility. Primary reason for this was to keep people covered and have access to, in particular, those COVID-19 testing, vaccinations, and treatment. But now that all comes to an end, and the continuous enrollment coverage does end on March 31st, and that is why we are restarting renewals. We have 3 primary goals. One is to comply with CMS requirements, and Jennifer will be talking about some of those in her presentation. The reason we need to remain compliant with CMS is they do have the capability of penalizing us. Any state Medicaid agency that is not in compliance with requirements could receive a penalty. They could also do what's called deferral of our federal match. The majority of our expenditures, the cost is covered by the federal taxpayers, and that means about 80% of our expenditures are through our federal match. That could have an enormous impact to our state budget if we're not able to draw down that federal match. So very important for us to stay in compliance. But really, two other critically important to us are preventing an administrative termination. By that, I mean someone who is eligible, but for whatever reason was terminated because they didn't take action. We do not want them to lose coverage. So during this time, you're going to see us talk about, and some of the activities that we're doing is to ensure that member understands whether or not they need to take action for us to be able to do a redetermination and to keep them covered. We do know that throughout the public health emergency, some individuals have become ineligible. Either their income has increased over the Medicaid federal poverty level, or the category in which they've received their coverage has ended. For example, we did extend 12-month postpartum for pregnant women. We do have women that are outside of that 12-month period, meaning they're no longer eligible. So people in those categories that for whatever reason their circumstance changed, or they the reason for their categoric eligibility ended, we've continued to keep them covered, but now with the unwinding, we're going to have to take action and end their coverage. We want to ensure that those individuals have access to other healthcare options, that they know and understand what those options are, and that they receive support to attain that coverage. A lot of that is going to be qualifying for a qualified health plan on the state-based marketplace Connect. We want them to understand what those health plan options are and how to enroll in those to ensure no gap in their coverage from Medicaid to that health plan. So now I'm going to turn it over to Jennifer and let her speak a little bit about some of the changes that affect your enrollment into Medicaid.
Thanks, Veronica. Good afternoon, everyone. First, I'd like to talk about provider revalidations for a couple minutes. So during the public health emergency, submission of a revalidation was waived. After May 11th, the revalidation process will begin. But in order to help us out, because we will be inundated with revalidations, we do encourage you to go ahead and submit for revalidations as soon as you are able to do so. CMS has provided state Medicaid agencies with guidance surrounding new revalidation due dates. And this is for providers who were scheduled for those revalidations during the public health emergency. The new adjusted due dates will be displayed on your provider file in portal, and those will be available on May 12th. So what you're seeing today might change on May 12th. So encourage you to make sure that you go in on that date to check to see if your revalidation due date or to see what your revalidation due date will be. But again, regardless of what that due date is, if you can go ahead and submit for that revalidation, we encourage you to go ahead and do that. That will assist us in processing all of our revalidations and getting them done in a timely manner. Next slide, please. So also during the public health emergency, we were allowed to temporarily enroll providers. And after May 11th, this will end as well. So for providers who are temporarily enrolled, you will be required to perform a maintenance application following May 11th, and that will help keep your provider file from inundating. So if this applies to you, you will be subjected to screening activities and or application fees that may have been waived during the temporary enrollment period. So you will need to go in, assure that you complete that maintenance application. And From a time frame perspective, we have a total of 6 months to fully enroll any provider who was temporarily enrolled during the public health emergency. So once May 11th hits, we will have 6 months to complete those. If a provider does not take action to complete a maintenance application during that time frame, the provider will be inundated at the end of that time frame. Next slide. So this is a screenshot of how you need to go about doing the maintenance application in Portal. This is where a user can start performing the maintenance or a revalidation. So once you've logged into the provider file, you'll see at the bottom of this screenshot, there are several options of what you want to perform. So the options include maintenance, revalidation, at the bottom, the radio buttons there, that's where you'll go to select what action you want to perform. And then that will move you forward into the next steps that you need to follow in order to complete that maintenance application. And just make sure that when you get ready to log in, you have that ID number. You will need that Medicaid ID to get started. You'll enter that. Some populated information for the provider will appear, and then you'll make that selection. Okay, next slide. So just to go over some of the additional public health emergency flexibilities that we have regarding provider enrollment that will be ending on May 11th. One of those was the Social Security card request. So during the PHE, we were allowed to enroll providers without the Social Security card. And that was because the Social Security offices at that time were closed. They were experiencing significant delays in processing card requests, but that flexibility will be removed. And so providers who have not submitted that Social Security card will be identified and required to submit a copy if you've not already done so. Additionally, accreditation. So during the public health emergency, we were allowed to continue participation with expired accreditation as long as the provider was able to submit a letter from the accreditation organization that confirmed the on-site survey was postponed due to the pandemic and that a current accreditation was active until the full survey was conducted. So that will also be ending, and that documentation will be required. And again, those flexibilities will be ending on May 11th. And I think that is what I need to cover. There is a listing there on the slide that that you can read that just outlines some of the other flexibilities. I've tried to highlight the ones that I think are most significant and important to cover in the webinar today. But with that, if anybody has any questions, please put those in the chat and we'll have some question and answer time at the end. And with that, I'll hand it over to Veronica.
Thank you, Jennifer. Just to cover a couple of other flexibilities that are ending that we think impact your ability to provide services to members. We are doing away with the second presumptive eligibility period. During the public health emergency, we've allowed 2 PE periods per calendar year, which gave individuals up to 4 months to file that full application. That second period goes away on May 11th. So after that date, individuals will go back to the 1 presumptive eligibility period per calendar year. We had some special reimbursement tied to COVID-19. These are reimbursements that were not allowed to extend beyond the public health emergency. They were particularly related to hospital and nursing facilities. So if you're those providers, there are some additional reimbursement that will no longer be paid past that date. We were allowed to extend some flexibility, and really CMS has control over what we can extend or put permanently into place. So we had lots of conversation with CMS about where the state does have discretion. But there are some that we've extended. For example, we have during the public health emergency to assist folks that are long-term care. We were disregarding excess resources, and so we have extended that flexibility past the public health emergency for 12 months so that when they're going through their renewal, we can continue to disregard that excess resource. Upon their next renewal, they will have had to spend down those resources. So we'll be working closely with members that are impacted by that. We also have extended the time that members can file an appeal and for the state to make a decision, and for re-enrollment of the member to their previous MCO if that re-enrollment occurs 120 days past the end date. We will be continuing to cover COVID-19 vaccines, testing, and treatment. The federal law requires it without cost sharing. In Kentucky, we do not have cost sharing for Medicaid members. There was a state law and our regulations were updated a couple years ago to put that law into place. We do not charge cost sharing. There are no copays for Medicaid members. So that will continue without copay. Want to note during the start of the public health emergency, when folks were not going into provider offices, we knew that people still needed to access care. And so we quickly implemented an expansion of telehealth, including the use of non-HIPAA compliant telehealth formats and platforms. So during the public health emergency, our telehealth, I know a lot of providers were able to be able to change to deliver that care where appropriate and in accordance with their licensing professional standards to be able to deliver that through telehealth. The coding guidelines also dictate when a service can be provided by face-to-face or telehealth, and Kentucky is following those rules. But for now, it's important to understand that even though the public health emergency is ending, the use of those non-HIPAA compliant platforms will still be available. And right now, under the Consolidated Appropriations Act, it's permitted through December 31st of 2024. If that changes, we will notify providers so that we can ensure that you get up to compliant with the use of those platforms. As I noted, we did expand telehealth, and we have now permanently implemented pretty much all those flexibilities around telehealth in our Regulation 907 KAR 3170. So you can go to that regulation and just verify the ways in which you can deliver telehealth to Medicaid members. I'm going to see if this works, but I wanted to jump over to the list of the entire list of the flexibilities that were implemented as part of the public health emergency. So on our website, the Unwinding website, we do have this very comprehensive list. And what it has is the flexibility that was implemented on the far left column. It also lets you know where we received the authority for that flexibility. There's a brief description of the flexibility that we implemented. There's a column about the decision that that Kentucky Medicaid has made on whether we're going to extend or if we have to unwind that flexibility and end it. And then other impacts just for us, basically comments about to provide some additional information about how we're implementing it, or in some respects, like this first one about expansion of telehealth coverage, the use of the non-HIPAA compliant platform remains available. We just want to track that so that when that date approaches, we're notifying providers. So again, on our website, this very comprehensive list of all the flexibilities and how those are changed or impacted by the end of the public health emergency. So now I want to go and talk a little bit about renewals of our Medicaid members. And some of these slides, if you've been participating in our stakeholder meetings, we held 3 last month, or if I've presented to your provider association, or if you've attended another meeting where I presented, some of these may look familiar, but we feel like they're very important to refresh memory, to reiterate some of the information so that people understand what's happening. And if there are new folks on today, this may be new information to you. So this is a high-level timeline of our renewals in Kentucky, and every state is approaching this a little differently. So some states are doing a shorter unwinding period. Some states are starting their renewals in a different month, but this is a reflection of Kentucky's plan. On February 15th, we did file a renewal distribution plan and system readiness artifacts. Those are 2 documents that we submitted and are posted on our unwinding website. The renewal plan, and I'll talk a little bit about that in a minute, is how we told CMS the actions were taken to distribute all the renewals across our 12-month unwinding period. The system readiness artifacts talk about all the system changes that we put into place for the public health emergency and how those we are going to unwind them, as well as the testing plan. We have to test our system to make sure that it is operating appropriately. We're resuming normal operations for enrollment and eligibility as of April 1. So just making sure CMS is aware of what activities we're doing. They want to monitor states, and this is their way of doing that. As I mentioned previously, on March 31st, 2023 was the end of that continuous coverage, continuous enrollment required or mandated under the public health emergency. States now have 14 months to initiate and complete renewals. On April 8th, we filed a baseline unwinding data report with CMS. That is just a snapshot, and I'm going to show you that data here shortly, but it's a snapshot of the state and how many applications are pending, how many hearings are pending. It's going to be data that CMS is going to use going forward as we file an updated report on the 8th of every month during the unwinding period. So CMS can monitor the state's progress with the processing of redeterminations. May 11th, as I mentioned, is the end of the flexibilities and our requirement to unwind any flexibility we're not extending or permanently implementing. And then we are conducting our renewals starting in May through April of 2024. So those with a renewal of May 31st, 2023, their coverage end date is May 31st, 2023, will be the first to go through a renewal. I talked about our renewal distribution plan, and what we did for that plan is to look at our workforce. We want to ensure that our caseloads are at a number that is something that our workforce, our DCBS workers, Department of Community-Based Services, eligibility workers, our sister agency who does our eligibility determinations and redeterminations. We want to ensure that we have an adequate workforce to handle that caseload. Kentucky processes renewals and determinations at the case level. So if it's a head of household, the members of that household, generally their eligibility is derived from that head of household eligibility, and we call that a case. So we have 1.7 million individuals, but we have, at the beginning, when we started this initiative, we had around 906,000 cases. In developing our distribution plan, we looked at December. It has the lowest or the fewest number of work days. So we wanted to ensure that the lowest number of cases happen in December to handle the fact that there are fewer work days. We aligned members of a household to ensure their renewal happened in the same month, so that when we process that case at the head of household level, that all of the members of the household's eligibility gets determined at the same time. We also aligned a Medicaid member's renewal to a SNAP renewal if they have a SNAP case. This also helps with having the DCBS eligibility worker just have to process the case once by aligning the SNAP and Medicaid renewals. For distributing the caseload across the 12-month of unwinding, we did decide to also allocate certain populations a little differently. You will note that between May and October, we have distributed cases where there is a Medicare eligible individual, 65 years or older. We did that because they are required to file for that Medicare application. They are eligible to do that. And they may not have taken that action during the public health emergency because Medicaid had been covering them. But with the end of the public health, with the restart of renewals, they now need to take that action to file their Medicare application. There is a special enrollment period for these individuals. Previously, if they had not applied for Medicare in their regular enrollment period, they would have been penalized. During the unwinding, if a Medicaid member files for Medicare and they do it within 6 months of their Medicaid end date, they will not be penalized. However, we are wanting to ensure these individuals immediately apply for Medicare so that there is no gap in coverage from Medicaid to Medicare. So for these individuals, we are doing a lot of outreach and connecting them to support with our Department for Aging and Independent Living, our sister agency. They also have SHIP counselors, SHIP. Those are State Health Insurance Assistance Program. They are counselors to help seniors age 65 and older understand healthcare coverage, Medicare enrollment, and can assist those individuals. So during this 6-month period, we will be outreaching to these individuals to understand that their Medicaid is ending, and if they have not already done so, they need to apply for Medicare. In June, you will see that we have a special population of around 14,000 individuals. This includes folks that in March of 2020, with the start of the public health emergency, were determined ineligible, but due to the continuous enrollment requirement, we have kept them covered. So every month since March of 2020, these individuals have had their coverage extended. Their end date is in June. These are individuals who will need to file an application for a determination as to whether they are Medicaid eligible. So we'll be reaching out to these individuals to understand that they need to take action. It is possible that they still are no longer eligible, but we want to ensure if that is the case, that they are able to move over to other healthcare coverage if they don't already have it. So if they qualify for a qualified health plan on the state-based exchange Connect, we will help them understand how to shop for a plan and to enroll in that plan. Or if they have access to employer-sponsored insurance, they can use their Medicaid end of coverage as a qualifying event to enroll in that employer-sponsored insurance. So these individuals, though, will have to take action, and we're providing a lot of support to them to understand what they need to do. The last priority population that's been distributed a little differently is what we call our QHP, or Qualified Health Plan eligible population. So these are folks that our system has noted they're over the Medicaid federal poverty level of 138%, but eligible for a qualified health plan and potentially an advanced premium tax credit, or APTC. APTC helps somebody afford a health plan on the exchange. It could make their premium no cost or low cost. So these are individuals, again, that we're going to help understand they need to take action and to choose other coverage so that there's no gap. We're waiting till July because we are doing some system changes and implementing some processes to help these people smoothly transition over to a qualified health plan. I'm not going to go through this whole process, but this is a snapshot of what it looks like. The darker green boxes are activities associated with the May renewal. The lighter blue are activities associated with a June renewal. The lighter green or beigey looking boxes are those with a July renewal. And then that bottom right box in dark blue is an August renewal. Just a couple of things I want to note, and if you have been on the stakeholder meetings, you probably have seen this before, is that, again, lots of communication going out to members. So they're going to get a notice, some type of communication about 90 days prior to their renewal end date. This is going to tell them that they are coming up for renewal, and to remind these folks who some have never, ever gone through a renewal before, that it's coming. They'll also get another communication about 60 days before their end date when their notice goes out, to let them know to keep an eye out in the mail for a notice. And then if there is no response from anyone who is requiring to take action by the 15th of their renewal month, we will send another communication. Now, even though we have one at 90, 60 days and on the 15th of the month, we will still be continuing to try to outreach to these individuals as frequently as possible to make sure they understand when to take action. We're going to be monitoring if whether or not we've received documentation or information from somebody who has an active renewal, and we'll be monitoring them. And for those who still haven't taken action, we'll continue to do outreach. So our system will go out on the 1st of the month, 60 days prior to the end date. So for May renewals on April 1st, our system did go out and do what we call an ex parte renewal. It goes out and tries to verify somebody's eligibility automatically. We have lots of different databases our system is able to check, including for income and assets. And if we're able to verify that information, the person is done. They're called what we call passively renewed. There's nothing further they need to do. If everything can be verified, they'll get a notice of eligibility, making them aware of the fact that they've been renewed. Their renewal date will change from May 31st, 2023 to May 31st, 2024. If our system was unable, just for whatever reason, to completely verify somebody passively, then those individuals are going to get a request for information. It's a pre-populated form that tells them that there's just something we were unable to verify. It tells them exactly what we need. It could just involve them calling and verifying the information with us. If there's something, a documentation we need, it'll tell them specifically what that documentation is that is needed, and they will need to send that in prior to their end date. Those are what we call a request for information, a passive renewal with a request for information. And then there's a third bucket of individuals. These are what we call active renewals. They receive a renewal packet. They are individuals who generally their eligibility is based on a resource or asset test. And so we need additional information that we're unable to do in any type of an ex parte process. So for these individuals, they're going to get a renewal packet that is pre-populated. It's several pages long. It puts in the information that we have available and already in our system. It asks them to verify that or to update the information, or if there's a gap in information that we need or documentation, it'll tell them what that gap is and what they need to submit. So in April, those notices have gone out. For those with the May 31st, 2023 renewal are ready. If somebody comes up to their end date and they do not take action, and June 1st, we issue a notice of discontinuance. If they provide us that documentation or verification within 90 days after their end date, we will go back and reinstate them with no gap in coverage. So again, even if somebody discontinues on their end date, if we can get a hold of them and get their information in within that 90 days, we will reinstate them. Individuals also have the opportunity to file an appeal for a fair hearing, and while that is pending, have their coverage extended. So as you can see, that process continues month to month, and in 1 month, we may have activities for multiple months of renewals that are ongoing. This is an example of the notices that our members will be receiving. The far left is that notice of eligibility, provides them their coverage date. If they were able to be passively renewed, it will automatically be sent at the first of that prior month. So for those with a May 31st, 2023 end date, they likely have already received their notice letting them know the coverage has been updated and a renewal date of May 31st, 2024. The middle document is a request for information. It usually is a page or two and only asks for that information we were unable to verify. And the far right is the renewal packet, several pages long, but again, only asks for the information that's necessary for us to make that determination. So your patients, these are providers, are able to respond to a notice in many ways. They can complete it and fax it or mail it in. They can go on to Connect, and if they have an account through the self-service portal, they can upload the information and provide documentation that way. We understand that not everybody can access or have the ability to utilize an online account, but for those who can, we're really emphasizing the need to create that account or to ensure that your account is active if you already have one, so you could utilize that as the mode of communication with DCBS. Connect is the fastest and easiest way for a redetermination to be processed because the member can take a picture and upload it and or scan and upload it, and then the DCBS worker can take a look at it in the system and do that and perform that redetermination. Happens quickly. It's able to track the documentation easily in the best way. But again, understanding that not everybody can do that, they can complete it and return it. They can call Connect or the DCBS hotline if they have questions or to verify information. They could also visit a connector, an insurance agent, or a local DCBS office. The way to find those is on our Connect website. You can Google, find a connector, find a Kentucky Medicaid insurance agent or DCBS office, and that'll get you there. Again, what we're telling our Medicaid members right now, what we're advising is that create that Connect account or keep your Connect account active. But more importantly, make sure you're contact information is updated with us. If we are unable to contact a member and help them and support them through the renewal process, they may be administratively terminated. That gap in coverage is not only bad for them because they can't have access to services potentially, but we also can't pay claims for anybody with that gap in coverage. So it's important that members keep that coverage intact if they're eligible or move to other coverage. So as you have a patient come in and are often asking them for updated contact information, asking the question as to whether they've also updated if there's been a change, also asking if they've updated that information with the state Medicaid office is a good question to ask so that they can call the Connect or DCBS hotline and update that information, or they can get assistance from the local office or from a connector to get information updated. And then just making sure they're keeping an eye out for any notices that might come in the mail. Excuse me. As I mentioned, we do have help in the communities across the state. Those connectors are available in multiple counties in our state. Those licensed insurance agents are available, can really support somebody through shopping for the health plan that's right for them on the exchange. I mentioned our sister agency, Dale, and their SHIP hotline. If you have a patient age 65 and older, those are really good resources for them. And then going to our website and finding material and communications that are specific to the population. So if you're a member or if you're a provider, we've got good information on there. So I wanted to provide you data on the Medicaid renewals that started for May 31st, 2023. So we had 72,421 cases that were due May 31st. Of those, 49,491 were classified as passive. These are the cases where we normally would be able to go out and ping all those databases and verify somebody's eligibility passively without them having to do anything. We were able to renew 60% of those passive cases. So those individuals did not have to take any action. This is a little lower than our normal passive renewal rate. And we believe the reason for that is because there is, we've been keeping people hanging on with coverage who've been ineligible during the public health emergency. But now that we're restarting, we want to make sure that if we weren't able to passively renew someone, we sent them that request for information just as a last option for them to take some kind of action to let us know whether or not they're still eligible. So we, again, expected a little bit of a lower passive renewal rate because we have been keeping a lot of people covered who may not have been eligible. We had 22,930 active cases. So these are individuals that would get that renewal packet because we've gone out and verified all we can, but what we do know is that there is a lot of additional information the state needs to make that redetermination because of their asset or resource test. Of those active renewals, since April 12th, 2023, we've had 479 actually complete their renewal. Of those, 347 have been determined eligible. 50 have transitioned to that qualified health plan and are APTC eligible. So our system, once they make that determination, will automatically transfer them over so that they can choose a plan on the state-based exchange. And then 82 of them have been determined ineligible. even though they've been determined ineligible, we've had that conversation, or we're providing that information that, you know, there are other options maybe available to you. Our system could not automatically verify that they're QHP or APTC eligible, and so they're not getting transferred automatically, but they are no longer eligible for Medicaid. Although they've been determined ineligible now, their coverage will continue until May 31st, 2023, and after that date is when their coverage will end. So as a provider, we're asking a lot of you. We want you to be part of our support network for members going through a renewal. So we're trying to give you information and tools available to do that. One of those is on Kentucky Health Net. We have added the redetermination date. You will see on the member panel in red a date. That is the date that as part of our redistribution plan for distributing the caseloads across the 12-month unwinding period. That's the new date that member is subject to a redetermination. There are some individuals who don't have a date, or who might have a date in the past, such as 2017. Those are individuals who are not normally subject to an annual renewal. And that's because, as I explained previously, their eligibility comes from some category. So, for example, our foster kids. Our foster kids are enrolled in Medicaid automatically based on the fact that they are in foster care. So their enrollment in Medicaid is dependent on that. And if at any time they're no longer in foster care, then their eligibility ends. And that's when we would take action with notice, of course. But they don't have an annual renewal. So as a provider, if you go in and you don't see a date, or you see a past date, then that means that that person doesn't have an actual annual renewal. It doesn't necessarily mean that the person won't be subject to a disenrollment. And the reason for that is because they're no longer eligible in the category. But those individuals will receive notices, and we are providing a lot of outreach to them. But for the ones that you do see a redetermination date, we're asking for you to share that date with the member if it's a date that's closing in. So, for example, let's say this is May 20th, and you see a May 31st, 2023 end date. Then those are the individuals that really need to reach out to through Connect, or through Kentucky Health, or through our hotlines, or to a local office or a connector, and make sure they understand that there is a notice out there for them to take action. Because if they don't before that date and a redetermination isn't made, then they're going to lose their coverage. So again, utilizing this information to help connect your patients who are Medicaid members with a renewal approaching to help take action. This is what our website looks like. I already showed you all in the bottom left. You'll see it's kind of small, I know, but Kentucky PHE Flexibilities Tracker. That's the tracker I showed you. Lots of information on this website. We've posted all of our CMS reports that we've submitted to date. We are posting all of our stakeholder meetings. We've recorded them and have posted them, including a frequently asked questions document that we will continue to keep updated based on new questions that come in. There, for a provider, we have a lot of information for you to pull down, 1-pagers and 2-pagers with information explaining some of the information I've provided today about what a renewal looks like. It includes easy information about how to connect that person to somebody who can help them and support them through the renewal. So just information for providers and members and other stakeholders to be able to understand what's happening. If there's something on there that doesn't meet your need, but you think that we could help you draft or we could create something, please reach out to us and let us know. This is about everyone working together to provide information. And if there's a gap, we want to know about it and try to fill it. So please let us know about that. And then, as I've mentioned, our Medicaid unwinding.ky.gov website, it is connected to the Health Benefit Exchange. So you may see that that email, that website ID. Social media, if you don't already follow us, or if you haven't liked us on one of those platforms, Facebook, Twitter, or Instagram, you don't have to do all three, but if you could utilize one. I had a provider come up to me and say, I don't do social media. So I said, well, do you have a child that does social media, or do you have somebody in your office that does social media? Just someone, so that you could be alerted to when we do post something of importance. We're only using it as a mode of communication that's really critical about the information for renewals and unwinding. So, you know, anytime that something we're finding something, a trend in something, or like a scam out there that's been brought to our attention, we're posting information about that. So it's just a great way to stay connected. And then we'll be having ongoing stakeholder meetings on the third Thursday of every month during the unwinding at 11 o'clock. So we had one earlier. We did record it. It'll be posted. We have some questions that we responded to, and those will be posted as well.